how can out-of-station patients take treatments at Saima? How long is the stay process in Cochin if they have to come here? And when one begins IVF, what are the pros and cons that they should seek after?
Okay, all three are very long answers.
Yeah.
The first part basically, yes, generally currently what facility that we have is earlier in India we could not do a lot of these online consultation, but thanks to COVID we have online consultations which are made legal, so we can actually kind of have a discussion, plan your treatment. Now planning your treatment, probably we'll have to know their menstrual cycle, so decide on what are the menstrual, how the menstrual cycle, depending on the menstrual cycle is how we will plan the treatment. Tentatively, a majority of the people will be able to do the treatment in 4 to 6 weeks.
Okay.
4 to 6 weeks. This is general. Now, if sometimes what happens if you have planned the treatment from there itself, probably you take an injection from there and come on the second or third day of your cycle. We can even do treatment like that. So at that point of time, you have to be here only for say a month. So when I say a month, like say we don't insist, or probably it isn't. First of all, I think everybody should know this is an OPD based treatment. You don't really need an admission to do the treatment unless you're from really far away and you don't have facility to take injections nearby and things like that. You can always stay in the hospital or around the hospital, but otherwise we don't insist anybody to get admitted to the hospital or anything. So we generally start with one particular injection, say around the third week of the previous cycle, then we call them back on the second or third day of the cycle, and then on that day we will start injections. On an average, the patient has to take around 10 to 12 days of injections. We'll call them after 7 days. The first gap will be after 7 days. Then after that, depending on the scan and the blood tests, we will decide, we call them after 2 days or 3 days. And once the follicle is ready, we give them a trigger, and 36 hours after the trigger, we take the egg out of the body. Now, at that point of time, we'll take the husband's sperm, and we have the egg and sperm with us. In the IVF lab, we fuse them, make into a baby, grow it for 2 or 3 days. Now, if things are okay, we actually transfer these embryos back into the uterus of the female. Once we transfer the embryos, again there will be another 15 days of supportive medications, because this is a completely controlled cycle. We are controlling everything in the body, so the body does not know that it's getting pregnant. So that is the reason that we are even having to give supportive medications. So we give them supportive medications, and it's actually 15 days after the transfer and the supportive medications is when we will know whether she's pregnant or not.
Yeah.
So that if you want to stay till then, probably it's like say on day 2, day 3 onwards, 15 days your treatment is done, another 15 days your process is done. So it's like actually your results are out. So it's 1 month will be the treatment if you look at it till the time that you know the results. And in some certain situations, we call them 1 week or 10 days before we start the initial process, so that we prepare everything, so we know that what is going to happen, we evaluate and all those things. So generally we say 4 to 6 weeks is an ideal time for somebody to come and spend here, and definitely you don't need daily hospital admission. You can actually come and go.
Something like what I did. I actually stayed for a month and a half near to the hospital only because the facility was near me. And where injections were concerned, I could get the proper timing to get myself injected, and I thought that was the ideal situation. So there was another question, like for example, if someone is coming for the treatment at Saima, do you suggest them to stay till their pregnancy, or they can travel back to US or UK, wherever they are coming from? Is that something you would recommend?
See, we have a lot of patients who come from the UK, US and all, who just come here, finishes of the treatment and goes back. So I wouldn't say that there is a major issue by actually traveling back, because a lot of people do that, and you cannot really
make them stay
and make sure that they don't travel. So it's practically not possible. So, but only challenges, especially in difficult patients, where we might have to support them with additional injections. And see, those group of people, what happens with them is that, see, when they go abroad or when they go to US, see, them to get medical care is very difficult. So when they go, see, you need to, if there is a problem, if there is bleeding, you have to go to see the doctor, and then the doctor will give you an appointment to see a specialist. Now seeing the specialist will take another 2-3 weeks because to get an appointment for the specialist. But in that way, Indian medical system is so easy. You can meet the super specialist any day. You can walk in and meet a super specialist. Unlike
how it is.
How it is in the UK.
I understand, because with the NHS it's the same thing as well. It was difficult for
me. Technically we don't say, but then when it's a difficult case or something like that, we always say that, okay, let's see how the pregnancies and then decide as to how we go. Because see, what is unfortunate is that now if things, honestly, if you're not able to give enough support, if you're not able to, and if it fails or it becomes an abortion or something like that happen, see, you have to go through this whole process again. And when you're going through this whole process again, you really don't know whether you're going to get again pregnant. See, that is the biggest challenge. See, it's just not about what you say, just you going through this process and it's like, oh, you get an abortion, okay, let's try again. You really don't know the next time you might not get pregnant again.
I know.
So that is a big challenge. So that's why I said regular patients, I don't think there is any specific reason that they should stay back.
So it depends on the patient, how difficult the situation is and their processes.
Correct.
Then you would suggest whether they can
prefer
travel
to stay,
or perfect to stay.
Because probably when things are under control, probably I would say we sometimes little over-treat them also for the same reason that you really don't want something to happen. You don't want something to happen and later on say that, okay, I could have done that also. Okay, I learned it now, let's do it the next time. See, what happens, to be very honest, what happens in the UK or the thing is that they have set protocols. Yeah. They cannot do a particular treatment unless it is proven that it is good. So they will wait for you to fail so that the next time they can correct it. Yeah. But the problem is the next time we really don't know whether you're going to get pregnant again.
Yeah, true.
So India, fortunately in that way, we are having the resources to make sure that we give you everything possible to make sure that it carries on. Yes, so sometimes this is probably one particular situation where some little over treatment is better than under treating.
Of course.
The difficult ones, I am talking about the difficult ones, not the regular patients.
Yes, absolutely.
Whenever a patient comes to, this is something which I always tell in majority of my talks, like I think whenever a patient comes to you for a treatment, I think they should have 3 basic ideas of when they are doing process. One, what is the process, or why are we doing an IVF, or is that the right treatment? Have they decided, and how they are deciding on the treatment, and what is the process? Like I was telling you, like you have to come on this day, then come on the second or third. So they should have a clear picture as to how the process is going to happen, so that they can also be prepared. Because it's just not about just coming one day. A lot of times what happens is you come on this day, the patient will go and come back the next day. Say I come on third day. See, when the patient is not prepared, it might cause unnecessary confusions and things like that. So one, they should have a clear idea of how the process that we are going to do is going to happen. Second, very important is we should always talk to them regarding the cost, a tentative cost.
Absolutely.
We should always tell them this is the tentative cost that is going to come for the procedure, this is the tentative cost that's come for the medicines, the blood tests. So overall this is what you should expect while you're doing this treatment and things like that. So a basic idea of the cost. Now little variation can happen. Certain people might need lesser medicines, might need, you'll only give them less, the cost obviously become lesser. But when you look at difficult cases where you have to give them higher dose of medications, that time the cost might become.
Yes.
And the third and the most important aspect is to understand the results. Because when they are doing a treatment, they should have a very clear picture as to how much is the results that they should expect for doing the treatment. Now, because that is the most difficult and difficult part to convince the patient, because if you realize the best result in the best patient is not more than 40 to 50%. Now as the problems increase, the results will keep coming down. See, a normal husband and wife, they try to get pregnant, the best result is around 20% normally. So when there is a problem, the results are much lesser. So when they try to do some treatment, and like say treatments like IUI and things like that, we are trying to reach that 15 to 20%, that's all. But with IVF, we are able to double that result. That 15 to 20%, we are able to get 40 to 50% with an IVF. Now that is the best group of patients. And with the problems like the age, the disease because of which we are doing an IVF for them, all those things, the results will start falling. So a patient, if what I believe is a patient goes to any good clinic, every clinic should be able to give them the same result.
Yes.
Because it's as simple, because ultimately the sperm, egg and the uterus and the patient. So if the same, because these are the byproducts are the most important aspect. And that's when I said specifically that it's in a good clinic, so I'm assuming that at least majority of the good centers will have a good lab, good facility, good medications, good protocols. So if they're able to, see, because why I'm saying this, a lot of people will call us and say, what is your result of IVF? See, it's not the IVF center's results. it is the patient's
Individual,
results.
yeah.
Because a 25-year-old female who has slight husband sperm abnormalities, that is the only problem, her results will be very high. At the same time, a 25-year-old with endometriosis or having multiple surgeries in the ovaries, the results will be much lower. So the results are of that patient. It will be very different from the results of the patient before you, different from the patient after you. So you cannot say that, okay, that patient the results were this, so my result. Because I end up seeing a lot of people like, they're so surprised when I tell them that, okay, you should expect say 20% results or 25%.
Disappointed.
Like, so they're so disappointed. But I think, or I believe that they should have an idea as to how much they should expect.
Yes.
They should not over expect, they should not under expect. They should have a clear idea. So it will help them to face the failure if it happens.
Yeah.
And you know that when I say 40 to 50% success rate, that means 50 to 60% failure.
Yes.
So it is easier for them to face it. So these three are the most important things that a patient should understand before we go for an IVF treatment.
I think the mindset when they come for a treatment itself, they think it's going to be a success.
Success. So,
okay.
That's what we should be very clear. We should always tell them, because a lot of people are so. I have patients who have come, and when I told them that this is a result, they just walked away. They said, "What? I don't know." I've seen people who are 45 getting delivered. I said, "Yes, I'm not saying that you will not get pregnant, but what I'm trying to say is that the results are lesser. I'm just saying that results are lesser. See, look around you. How many of your 45 years or 42 years or 50 years you're seeing them pregnant compared to somebody who's like 32, 33? Yes. So definitely, as your age increases, your success rate will decrease.
Yes.
And so whenever we are doing a treatment, or depending on the problem, we should always accept the result and then do the treatment.
Yes. I wanted to ask you another question, which I shall just get into that. The approximate cost. Do you usually discuss this with your patients as well? Do you give them like a approximate estimation?
Yes, very. Like I said, the second most important thing that we tell our patients is the cost.
Would you be able to tell my viewers?
Yes. See, generally what we do is like we charge around 95,000 rupees as the hospital charges, which includes all the things that happens in the hospital, the embryology, lab charges, all those things. Then in addition to that, approximately around, depending on the patient, the medicines and blood test, everything will become extra. So it can vary from say 60,000-70,000 rupees to 1 lakh, depending on the severity of the case. So I'd always look at when a patient goes for an IVF, they should expect somewhere between 1.5 to 2 lakhs as the approximate cost of the treatment that they're doing. Now, again, this is again a question that a lot of people ask, like you said this, like it took us 4 lakhs to do the treatment. It took us, see, now if you calculate the auto that they came in every visit and went back, if they calculate they had to come and stay in a hotel and you add those charges, lot of times you ended up having to do another procedure in between. For example, there will be we might have to do hysteroscopy or some procedures while during the process. Yeah. All these things are additional costs. Yes. But if you look at IVF per se, when you're doing it, it is somewhere between 1.5 to 2 lakhs. A normal patient without too much of a problems will be able to do a treatment and say 1.5 lakhs. But then at the same time, a little older patient whom we might require a little higher dose of medications and things like that
could go a little more than that. Yeah. So I would say more than 2 is what
around 2. And say if you do an additional procedures, like say if you're doing a hysteroscopy, if you're doing if you have to do a laparoscopy in between, if you have to do advanced procedures like IMSI or like IMSI is like selecting the sperm under a very high magnification, especially in repeated IVF failures patients. If you want to do sperm selection technique, some kind of different kind of sperm selection technique, if you want to do all these additional things, probably there can be a basic additional charge that goes in, but basically it generally is somewhere between 1.5 to 2 lakhs.
Okay, great.